My name is Gracianna Venerable, and I am the Joyful Eating Intern for Alison St. Germain, our ISU Student Health and Wellness Registered Dietitian. This is the second video in the series setting the stage for medical nutrition therapy using a weight-inclusive approach. This video specifically is looking at diabetes and how to use a weight-inclusive approach. All the information and materials in this series focus on health and not weight, even if weight loss might play a role. So we're focusing on shifting the focus to health-promoting behaviors, leading to more sustainable health outcomes and without any harmful stigma and messaging. All the information in this presentation has been verified by Alison, so you can be sure that it's all credible information. So today we'll be discussing weight loss barriers with diabetes, harmful TikTok diets and recommendations, gentle nutrition, and other health-promoting behaviors. I'll provide some handouts and resources for students and for your own further learning, and I'll talk about how you can work together as a team with the dietitians. So like I said before, all information and materials in this series will focus on health rather than weight, even if weight loss might play a role. So we're shifting the focus to health-promoting behaviors, leading to more sustainable health outcomes and without any harmful stigma and messaging. So, when we ask our patients to lose weight, a lot of things can happen. First and foremost, many turn to TikTok or Google for information, often incorrect information. Weight cycling can occur. The diets aren't sustainable. Over time, this can lead to an overly restrictive diet and high-intensity exercise, leading to intense body stress and malnutrition. So weight loss and weight loss sustainability is difficult for anyone, even for people without diabetes, and diabetes only increases that difficulty. And it's important to know that even if weight loss can help manage symptoms for diabetes, it's not going to be sustainable in the long term, with only an average 5% success rate if you count weight loss as a success. So, because this isn't sustainable, we don't want to recommend it. And if you're not sure how to explain this to people, it's generally more helpful to not say anything at all than to recommend weight loss. So, diabetes is caused by a combination of a variety of different factors and not about being lazy. So the combination of genetics and lifestyle are what plays into diabetes, but laziness is often the assumption. There's actually a very strong genetic component as well. It's important to ask the question, does the weight gain cause the diabetes, or does diabetes cause people to gain weight? Because there's no clear answer to that question, it's important to not recommend weight loss in general. And kind of reiterating, it's difficult for anyone to lose weight and maintain that, but with diabetes, it's even more difficult. And another layer to that is the bias and discrimination people in larger bodies often face, and with diabetes as well, leading to poor health outcomes, inequitable and non-accessible healthcare, and unsustainable results. Some common barriers to weight loss that are more specific to diabetes patients. One of them is insulin resistance. So prolonged insulin resistance can elevate blood sugar levels, leading to the body storing excess sugar as fat, and also increasing hunger signaling, which can result in strong carbohydrate cravings. Diabetes medications can also cause weight fluctuations like insulin and sulfonylureas. These can range from appetite changes to slowed metabolism, fluid retention, and changes in fat storage. And also, past attempts to lose weight can make weight loss even more difficult. Usually this means a restricted binge cycle has occurred, and that promotes weight gain and an unhealthy relationship with food. With each weight loss attempt and weight regain, like I just said, the person's set point weight becomes higher, and that actually makes it more difficult to lose weight on the next attempt. So that's important to keep in mind. And dieting and weight loss are also strong predictors for disordered eating, food obsession, cravings, malnutrition with muscle loss, and weight cycling, so it's important to keep that in mind. And like we've said in past episodes of this series, weight loss is not a behavior but a symptom, and it's often a symptom of a much larger and more complex issue. Like the analogy Alison has given in the past ones of the cough drops, I won't go into it in full detail, but the cough drop was able to treat someone who had a basic cold, but didn't help anyone who was facing a much more complex issue. And that's often what weight loss can be with certain conditions. So it's kind of a good story to talk about how symptom-based treatment often won't get to the root of the issue. So shifting to some more specific health-promoting behaviors, keeping in mind health focus and not a weight focus leads to sustainable outcomes regardless of weight change. So even if the weight does not change in the end, there are other markers we can use to show that a health change has occurred. So for example, physical activity and movement is a great health-promoting behavior. And in the case of diabetes, it can help with insulin resistance and provide mental health benefits. So promoting things like a glucose walk after meals to help stabilize blood sugar. Consistent eating time and patterns are also really important. So eating consistently throughout the day and not skipping meals. High quality stress management and high quality sleep are also very important. Poor sleep and poor stress can affect hunger and fullness cues, and intensity, mood, increase anxiety, and increase depression. Also, decreasing or abstaining from alcohol, tobacco, and other substances is very important. Oftentimes, weight loss is given all the glory and praise for improved health outcomes, but in this series, we're going to be highlighting these health-promoting behaviors and how these should be really getting the glory for the improved health outcomes. So some gentle nutrition specific to diabetes. We're thinking about nutrition by addition, so what food can we add and not what food can we take away. And in the case of diabetes, this often means pairing carbohydrates with a protein and or a fat and eating those at the same time. By combining fat and protein with carbs, this is going to slow the digestion of those carbohydrates and allow for a slower and more stable release of sugar into the blood. And this also applies to increasing whole grains and fiber as they help slow digestion and therefore that blood sugar level. Along with gentle nutrition, we want to focus on being flexible and not rigid. And this means supporting and normalizing eating a variety of foods. But with diabetes, that could mean including treat foods. And if that's higher in carbs, how do we do that? By exchanging another carb or pairing with a protein, fat, and fiber. And I'll talk about that more later. And then also awareness about how certain foods affect blood glucose and how then to pair with protein, fat, and fiber. So noticing how the body feels after eating certain foods and how certain food and food combinations affect blood sugar. And over time, this can help someone figure out what works for their own body. Consistent eating patterns are also very important. So skipping can lead to major blood glucose fluctuations, and carbohydrate counting can help someone find consistent carbs. And then lastly, the flexible rule of 3, shooting for 3 groups on a plate from the My Plate, and prioritizing one of those 3 as protein to help with that carbohydrate and protein piece. So another way to kind of talk about choosing food in a balanced way is thinking about what do you want to eat? So what sounds good? What do you need to eat? And in the case of diabetes, this can encompass interoceptive awareness, thinking about how a certain food feels and if it makes their blood glucose go high, or if someone hasn't eaten in a long time and they have hypoglycemia, what food do they need to eat to help their blood sugar? And then lastly, what do they have access to? So what food is available to them to eat? And these are all things to consider when choosing food. When it comes to diabetes, there's a lot of false advice, particularly on the internet. And a lot of times people are suggested to follow keto or very low-carb diets for diabetes management, but there really is no evidence to suggest avoiding carbohydrates is helpful, and there isn't a clear diabetes diet or need to eat special foods, but it is important to have consistent carbs, and this can be taught through the carb counting method if necessary, and it can be taught in a flexible and sustainable way. For diabetes as well, it's important to have moderate saturated fat intake because of the association with hyperlipidemia. Another diet commonly recommended is intermittent fasting, but this actually has an increased hypoglycemia risk, especially if someone is taking insulin or diabetes medications. The blood sugar instability comes with the prolonged fasting periods, and there'll be large swings in glucose, which can be harmful in the long run. And then lastly, a lot of people believe they can't enjoy sweets or high sugar foods anymore if they have diabetes, but that is not the case. They just need to be enjoyed with attunement, the key word. So thinking about planning ahead for high sugar or high carb foods, So for example, at dinner, cutting out a carb from the main dish, like bread, pasta, or mashed potatoes, and choosing to enjoy those carbs through a high-sugar dessert or high-carb dessert instead. So we can enjoy all the foods, we just have to be a bit smarter about where we have them. So, as a provider, since you only have about 15 minutes to assess, treat, educate, and work with a client, you can work together with a dietitian and streamline the process. So on both sides, no weight loss recommendations, and the dietitian is going to focus more on carbohydrate counting, and the nutrition side of things, exploring macros and the effect of blood glucose, so kind of working on that attunement piece we talked about. But on the other side of things, educating on pathophysiology, on the medical side of diabetes and the medications is also extremely important, and providing resources on both sides. So keeping in mind as well, weight loss may happen as a result of the health-promoting behaviors that this person is starting to do, and that's fine. We're not demonizing weight loss itself, but this is not the focus of the care, nor does it get the glory for, say, improved A1C levels. That goes to the health-promoting behaviors like sleep, exercise, and gentle nutrition. And then lastly, we have a few resources, things like the Gentle Nutrition Handout and Sweet Support Podcast talking about intuitive eating with diabetes, so different things like that, carbohydrate counting, and some resources for further intuitive eating. Thank you.